So, how hard is hard enough? How do you know if you hit your head hard enough to have a concussion? You know if you have a concussion when you develop symptoms within the first 48 hours after you hit your head. And these symptoms can be headaches, dizziness, nausea, vomiting, blurred vision, feeling or looking dazed, confusion, fatigue, tiredness, slurred speech, ringing in the ears, or seeing stars. After seeing your doctor, check the after visit summary for symptoms to watch for and when to return for more care. So there currently isn't a test that will detect if you've had a mild concussion or a mild traumatic brain injury. Head CT scans and brain MRIs are reassuring that you have not fractured your skull or have a bleed in your brain, but don't be surprised if your test is normal or negative. Even if your brain scans are normal, you can still suffer a mild traumatic brain injury or a mild concussion. These tests will detect significant abnormalities, but they cannot see the damage at the cellular level where brain injury symptoms originate. You also do not have to be hospitalized, lose consciousness, slip into a coma to have brain injury symptoms that impact your personal and professional life. One of the first things my patients ask is, when will I get better? How long will it take me to recover? Well, most people recover quite quickly after a concussion within a couple weeks. And some will feel better after a month or two, while others, their recovery will span several years. Everyone's response to a head injury and their subsequent recovery is as different as their personality. So the saying goes, if you see one traumatic brain injury, you've seen one traumatic brain injury. If you broke your ankle, it's usually not expected for it to heal 100%. After it heals, it may feel weaker, be easier to twist, or ache in the winter. Knowing this, why would anyone think the brain will heal 100%? That's high expectation for a soft, squishy organ with delicate cells. Normally in neurology, we reassure our patients that brain injuries can take up to 2 years to recover, but that doesn't mean that the brain does not continue to heal after that time frame. Because what you'll see is that you'll see more improvement at frequent intervals at the beginning, and then after that 2 years, you'll see subtle changes that your brain is getting stronger and better, and those changes will be a little bit less frequent. While you're recovering, you may wonder or feel like something is holding you back, and that is your brain, because your brain will communicate with you and let you know when it needs to rest and take breaks. I don't know about you, but before my brain injury, my brain and I worked together very well. But after my brain injury, I felt like there was two of me. There was me and my brain. Your brain will heal when it's ready to heal. This is something I say often to my patients. All you can do is support its healing. You can't speed up the recovery. One way to support healing is to listen to your brain. Your brain will communicate with you through your brain injury symptoms, letting you know what it needs. For example, If you are working on a computer and you develop a headache or dizziness, this is your brain letting you know it's getting tired and it needs a restful break. One way to monitor your brain's needs is through journaling your symptoms. And I will speak more about journaling and the importance of journaling in a future video. With these things in mind, it's essential to be realistic about your recovery. You need to allow flexibility for a couple steps forward and a couple steps back, and for periods of regression in your recovery. A concussion is not a cold where you can expect to feel better in a few days. While recovering, it's best to look back on your accomplishments. Don't focus on what you can't do today or worry about the future. Try to stay in the present moment as much as you can. And have patience with your recovery and be kind to yourself and your brain. Please remember, you have survived what has killed others. You are a survivor and a badass, and you can do this. Like and follow for more.